Welcome to Black Health Matters. I'm Daryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
details kind of details kind of ways to reduce the risk of stroke. And since we're all in that age group, it's sensible for us to look at the different uh, items. This is based upon an article that was actually in the Washington Post last week that talked about the fact that stroke is going to increase by 50% in the next 25 years. And I guess most of us know what a stroke is. A stroke is a situation in which the brain is damaged by either a blood clot or which stops the flow of blood into the brain, or hemorrhage, which damages and destroys brain tissue. And since this is becoming very common, one of the things is to keep in mind that it is very closely related to management of your blood pressure. And as we look across the globe, it's clear that stroke is the number two cause of death, with heart failure being the number one cause of death. And so there's a lot we need to do, especially since it is particularly involves people of color. We have more hypertension and diabetes than other ethnic groups. So one of the first things we need to do is to be able to check our blood pressure at home at least twice a week to keep our blood pressure at or below 130/90 with or without medication. Say that because the group that seems to have the highest blood pressures as we screen patients is a group of people who know they have hypertension and are supposed to be taking their medications, but they aren't. And so the important part of it is that you need to be sure that your blood pressure is controlled, because that's the number one issue and number one cause of strokes. The next thing is to decrease your salt intake. That article is a little tight on the salt control. I've usually used 2 grams per day as the level. They suggest it's 1.5 grams per day, uh, which is even lower than what I had thought. But it is clear that sodium increases the risk of high blood pressure, which is the number one cause of stroke. Then a lot of people, as you age, get atrial fibrillation where the heart is not beating as strongly as it was before. And of course, that would mean that your doctor would put you on blood thinners and also normalize your heart rate. And that's what must be done in patients who have atrial fibrillation. Otherwise, they will get blood clots and have strokes. High cholesterol level, actually, John was talking about atorvastatin, which is a medication to reduce the cholesterol level, because high blood cholesterol level increases the risk of stroke as well. And if you have a question, but if you're a diabetic, then maintaining a normal blood sugar level and keeping your hemoglobin A1C below 7% becomes important. Of course, if you've got sickle cell disease, one of the things we know is that the hemoglobin A1C is not how you measure it. You have to use fructosamine levels rather than hemoglobin A1C if you've got sickle cell disease. But if you don't have sickle cell disease, is normal. Hemoglobin A1C of less than 7 is ideal. Then number 6, get plenty of exercise. We know that the minimum is 30 minutes, 5 days a week. And this doing at least 100 walking can reduce your risk of all cardiovascular diseases, including stroke. Now, one of the things we recognize now is that sitting is as dangerous as smoking. and sitting for more than 13 hours a day nearly doubles the risk of stroke. And then, of course, still far too prevalent in this country and in Europe is smoking, which doubles the risk of stroke. Although this risk decreases significantly after you stop for at least 5 years. Then maintaining a healthy weight, because overweight and obesity is linked to an increased risk of stroke. And so knowing what your weight is and knowing what your BMI is, and if your BMI is over 30, then you're going to increase risk for stroke. Then nutrition plays a major role in eating vegetables, less red meat, and more vegetables, fruit, seafoods is a good way to, that's the proper nutrition that you need to have. And any of those issues is important. Limit salt intake, less red meat, more vegetables, fruit, seafood is important. There's a lot of controversy about eliminating or decreasing the use of alcohol. You read a lot of articles and they're confusing because they say that you can drink 1 to 4 cups of alcohol, whether you're a man or woman, a day. And probably the best thing to do is to eliminate it completely, although the Bible says a little wine for the stomach's sake is okay, but I think you're better off without it. Then finally, controlling stress is easy to say, not as easy to do, although meditation and prayer are therapeutic for reducing stress. One stressful event increases your risk stroke by 17%. 2 increases it by 31%. So meditation and prayer are things you do, among the many things that you can do to reduce stress, including exercises we mentioned before. But often meditation and prayer are not recognized as being therapeutic for reducing stress, but they are. Then finally, to know the signs of the stroke. If you notice any of these in yourself or someone else, call 911 right away, because you lose about 1 million brain cells a minute once you have a stroke. So you have numbness, weakness in the face, confusion, trouble seeing in one or both eyes, trouble walking, dizziness, loss of balance, or severe headache. Those are reasons why you should call 911 and get somebody to take you to the hospital right away. You shouldn't drive to the hospital because you might never make it. So these are some of the things that are very important. Any comments or any additions or comments about these ways to prevent stroke, which is so important for people at our age?
Dr. Callender, I've been checking my blood pressure at home, and when I first started, it was my top number was in the 140s. I think the first time it was 147. So I know that's too high. But then the last time I checked it, the top was 136. So I'm coming down.
Great.
And
okay.
I stopped my yoga for a while because I fractured my rib a couple months ago, but I started back on yoga, so that really helps with the blood pressure.
Any other comments or?
No, this somewhat hits home for me. I have a very good friend, or had a very good friend, who had a massive stroke. And it was just shocking because I saw her just a week or less earlier. And within 3 days, she was gone. The funeral was last week. And
Wow.
to myself, I said, how can you be so healthy? And then all of a sudden, life is taken away from you. Well, after talking to family members, she did have some health issues. She was a diabetic, But as you say, Dr. Callender, all the time, is so healthy to keep your doctor's appointments. And one thing you've always stressed is proper diet and exercise. I don't know if some or all of these contributed. I just knew about the diabetic situation, but it was soon, it was sudden. And I never noticed any of these underlying conditions, but it's a personal thing. Now you just have to take care of yourself. And I say that all the time. And my friends and I say it often now. That's an example of no day is promised to you. Take care of yourself. Do what you have to do now. It was just so sudden. It was shocking.
Yeah, so many of our people of color have either heart attacks or strokes and
Yeah.
just go away. So,
Yeah. Mhm.
and the older you are, the more likely you are to have some kind of event. And so,
Yes.
uh,
Yes.
exercising, nutrition, and
Mhm.
we don't talk much about proper sleep, but that's also an important part of it.
Mhm.
Any other comment or uh, feedback? Okay, well, let's then go to the next. This is an article that I put in because I thought it's an issue. There are two things that are so important in life. Gratitude is one of them. Forgiving is another one. But this is how we all have tough moments. All of us have tough moments. We have children who are sick. We have our own sicknesses, and sometimes we think about how unfortunate we are. And then as things happen, you realize how blessed you are because you're alive and you have so many others who aren't. So many who aren't alive, some who aren't able to help themselves, and so many ways in which we have been blessed to be alive in a relative degree of health. And so, as this article takes you down the line, it just points out that uh, in spite of the many things that are going on, if you look around you, like, you remember they talk about the person who had trouble with his feet until he realized that there's somebody around him who had no feet. And so one of the things that helps you is when you look at other people around you and you kind of think about uh, how important it is to be grateful for what you have. And even when you're distressed and you have complications, still being grateful and appreciative is something that we can always do because there's always someone next to us who is not as fortunate as we are. And while we're grumbling and complaining about how tough life has been for us, uh, gratitude can often be a healing force. And that's uh, this is what Albert Schweitzer said. Times our own light goes out and is rekindled by a spark from another person. Each of us is called to think with deep gratitude of those who lighted the flame within us and appreciate the blessings that we have. And we don't take them for granted, but thank God for all that we have, no matter how little you may think it may be. Okay, next one. Any comment or feedback? This is an article on foods that are good for your cholesterol. Very often when you have a high cholesterol, dietary changes can be helpful, but sometimes that's not enough. Uh, some think of shellfish and eggs as being associated with raising bad cholesterol, although there's a lot of controversy about that. Cholesterol is a substance that is produced by the liver, and we have two cholesterols: the HDL, which is thought to be good, and the LDL, which is thought to be bad. LDL is associated with heart attacks. High HDL is supposed to be protective from heart disease. Cholesterol and other fats can block your arteries too, and of course, that's what the problem is with the cholesterol, is that you get deposits in your blood vessels that prevent the circulation, which then provokes heart attacks and strokes. What is kind of surprising is that cheese, which is often thought of as a problem, is not is often associated with HDL more than LDL, although substances and other products, for example, green vegetable nose lady's finger is known to lower the cholesterol by binding it. I don't know how many of us have that. Okra is something that was common in my family, in the West Indian family, and that's known to reduce the risk of heart disease. So lentils also are supposed to do that, and so will reducing the meat consumption. Nuts is one of the surprising ways that you can lower your cholesterol. Hazelnuts, walnuts, pecans, and almonds thought to be good. I don't recommend salted peanuts, but of course, for obvious reasons. I don't know many of you know about tofu, but tofu, when you scramble it with eggs, can help cholesterol level as well. Omega-3 fats also lower the blood triglycerides, and there's much talk about the role of omega fatty acids. I'm sorry, omega-3. Vitamin C and E also are good to lower the cholesterol. So it's you know, as we talk about blood tests that you need to know about, we talk about the hemoglobin, and we talk about the hemoglobin A1C. Well, knowing your cholesterol and knowing what your HDL is and what your LDL is becomes important as well as the blood level that you about you that you need to know about yourself as you go on from day to day. I know many of you may like spinach or Brussels sprouts, collard greens, which are also good to lower the cholesterol levels.
Dr. Callender, I had a question about you mentioned eggplant and okra, and I had a question about avocado. So I've had okra maybe twice in my life, and it just felt like it was really greasy. Is that true? Is that
Well, okra is good for lowering the cholesterol. It may be greasy, but it is also good for lowering the cholesterol.
okay? I mean, it's counterintuitive. And what about avocado? Avocado also.
Yes, yeah, avocado also is thought to lower the cholesterol as well.
Cool.
I haven't eaten okra or avocado in a while, but avocado was one of the healthiest items that we discussed that isn't mentioned in this article at all.
Mm-hmm. All righty.
John, this is Sylvia. I kind of bake my okra and it dries it out a little bit. You might want to try it. Season it up and throw it in the oven. Olive oil, salt, and pepper.
Okay, I'm making note of that. Thank you very much.
What about fried okra?
Okra is and for those who don't like the greasy taste of it, fried okra is how we usually had it, as a matter of fact.
That's how I love fried okra.
Yeah.
Well, it depends on what you fry it in, because you could be picking up some bad fats from your oil, but you could always air fry it.
Mm.
So yeah. Okay.
My wife has an air fryer.
I have one. I don't use it, but I have one.
Maximum.
This is an article that says that the foods that we tend to like, ice cream, chips, and candy, are just as addictive as cigarettes or heroin. I guess that's open to question as to how addictive they are. There's no question they are addictive. Staying in the same class as cigarettes or heroin is interesting because there are people addicted to everything you can imagine, including candy, chips, ice cream, so forth. But I think what the point that they're making is that the ultra processed foods, high fat, carbohydrate, and sugar, and these are not good for us. And they appear to be addictive because people can't stop eating ice cream, chips, cheeseburgers, French fries, and all those things. And as they get more depressed, they eat more of these foods, and then in the final analysis, some of them are linked to cognitive decline, like dementia. But food addiction is not classified as a mental illness, although this author considers it such. I think Dal has talked about how many of these addictions can be done away with by just avoiding them for a period of 6 weeks or so. But the food addiction issue is something that is very contributory to bad health.
Dr. Callender, you hear of people having a sweet tooth. So they're addicted to sugar. Then you have people who are addicted to chocolate, Snickers bar, almond joy, any kind of chocolate like that. Some
Reese's.
Yeah, Reese's. That's got peanut butter in that. But yeah, I think that people are addicted to salt as well.
You name it, people are addicted to it. Yeah. And food is addiction certainly is something that is killing many people. Does chicken soup really help? Well, I think that's one of the things that is circulated widely is that if you get sick, you get some chicken noodle soup, and is it really beneficial? And this article talks about the history of soup and broth and how it is good for you, and the fact that when you talk about chicken soup, you're really talking about not only the chicken in there, but all the vegetables that are there. And this article talks about the taste, the so-called umami taste, and that the healing properties probably more related to many of the ingredients of the soup that are help your nutrition. It's one of the common remedies that people, when they get sick, you want chicken soup, chicken noodle soup. It may reduce inflammation and stuffy nose. Or is it just the hype about it? The fact that You think that it's going to do that. And this article points out the key ingredients of the soups and the fact that all soups are not alike, and some versions have a lot of antioxidants and some don't. And the antioxidants are thought to be the core, as well as the vegetables are the core aspects of the soup. What are your thoughts about it? How many of you take soup when you get sick?
I love chicken noodle soup. The only thing is, I can't stand chicken noodle soup that doesn't have some salt in it.
That's interesting.
I like it too. When I had COVID, I had chicken noodle soup, and I felt better. I don't know if I got well quicker, but I felt better. That's for sure.
And for me, I think it's a mental thing. If I'm feeling bad, I get chicken noodle soup, but I'm not making it's a can of Campbell's. And after I take it, mentally, I guess I'm telling myself I feel so much better. And generally I do, but hey, I don't know. But I love chicken noodle soup, especially when I'm sick.
This is Sylvia. I love chicken noodle soup also. And a lot of times after my chicken and my turkey, I'll boil it and make my own broth.
Right.
And then you can put it in the freezer and use it when you're ready to use it.
Yeah.
But I think it's something in the broth that they say.
Yes.
I've heard a lot about bone broth. You know very much about that, Dr. Callender?
No, I do not.
Uh-huh.
Dal, you know anything about that?
That's me.
No, I don't.
Okay.
Yeah, they were like boil your bones for several hours, and all of the I guess the nutrients from the bones would, is packed with a lot of vitamins, and so they encourage you to use bone broth.
Mm.
And you can get they say you can get bones from the butcher and just boil them and put them in a slow cooker or crock pot overnight and make your own broth. I've never done that, but I've just, saw a lot of discussions on that.
Back in the day, I used to hear my mom talking about bone marrow. So that's what's inside the bone. So
That's what makes the bone so important,
so
because
maybe
all of our blood comes from the bone marrow.
okay. So I think
It's amazing that when you go back 1900 years before Christ, that Solomon talked about that in the Proverbs, talks about bone marrow. Yeah, I'm sorry, you were saying something?
no, I was saying back to the chicken soup. I think we're just addicted to chicken.
Well, it's not the chicken, it's the soup that is so important. It's the vegetables that really are in the soup that's important. Well, while we may have a chicken love, but it's the vegetables in the chicken noodle soup that really make it so important. This is a controversial article. Why diagnosing Alzheimer's early is so important. Most of the clinical trials have not supported the fact that medication does anything for Alzheimer's. And so if you have a disease for which there is no cure, the question is, why is it so valuable to make an early diagnosis? This article suggests that IV infusion of this medication delays the cognitive decline by 27%, which is a third, close to a third, which is it's maybe helpful, but it's not a cure. And so, but what they're suggesting is that the earlier you use this, the better, the better, more likely you are to delay the progression of Alzheimer's. So if you actually believe this, then you would then think that it makes a difference. And so this then is thought of as a reason why you may want to make a diagnosis of Alzheimer's as early as possible. That's their perspective on it. It's not mine, because I would feel better if you could give me a number more like 50% or above. That is helpful. We still aren't absolutely positive that it's the amyloid buildup that is the problem in Alzheimer's. That's one of the theories, and it may well be, but the point is that the data that shows that 27% improvement is not as attractive to me as it is to that people who have done this work. Oh, it's progress. It is showing that we have a drug we're given IV that can delay the progression of Alzheimer's. That's what they're marketing here.
I heard it's very expensive also, Doc, right?
Yeah, because it's very expensive, and it's not, to me, 27% effective is not that great. But I think it's a field that is wide open for discovering medication that will really impact Alzheimer's in a way that most people can recognize the benefit.
Dr. Callender, do you know of any quick tests for discovering early onset of dementia, and separate those tests from just normal aging process when you lose your memory?
No, I do not know. No, I don't know of because the gold standard is to go to a neurologist and let them do their testing, and a battery of tests will more likely reveal the difference between the normal aging process and Alzheimer's.
Yeah, I was with my mother when she had her diagnosis, and you know, I wasn't doing very well on the test either. They were saying count backwards from 100 by 7. I couldn't do that.
That's interesting. Yeah.
Count, go through the alphabet backwards. Oh, come on, man. I couldn't do it. Couldn't do it. And then they had a series of numbers or objects, maybe 3 or 4 objects. And they said, okay, I'm gonna give you these objects, and in 5 minutes, I'm gonna ask you to name those objects again.
Mm-hmm.
And I couldn't do that either. Mom couldn't do it either. Yeah, so maybe I got it too. I don't know.
Don't write it down.
At my physical therapy, they have this machine that tests you. They are, like you're saying, John, they give you 2 articles, like a tree and a fish, and then they'll add a 3rd one next, and then you've got to say them back in the order that they will give it to you. Mm-hmm. And it goes on till you get up to 6 or 7 words that you have to remember in the order that they were given to you on the machine. And so they can test you there and see if you can go to 30 words like Daryl could.
I noticed the past couple of years with my physicals, the doctor does tests like that. I don't know if that's standard now for seniors to go through, say these 5 objects or say them. And then he'll talk about something else. And what is it we were talking about earlier?
Mhm.
And we do the counting things. It's stuff that he wasn't doing before with my physical,
Mhm.
which John, I did pass. I remember. Yeah.
That's good
How
for
many
you.
words in a row did you go to? 7, 8,
With
9?
five words. And we
Okay.
talked just for a few minutes. And it was like he was telling me he forgot. Or what was those 5 things we talked about? Oh, yeah, it was da 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 da. And it was some other little exercise, but I came through it pretty well. But I noticed previous years, we weren't doing this part as doing this as part of our annual exam or annual physical. So I guess testing the mind. I don't know.
Well, Janice, just listen to you. You don't have early onset.
I don't. You
No.
don't know me very well. I've been crazy lately.
John, your hand was up, Buchanan. Did you have something? Okay.
Oh,
I-
yeah, he was clapping.
I think one of the best ways to notice Alzheimer's in seniors that if you know the person and you are around the person, just noticing the changes in them. You know, I was around my mom, and day to day, you just notice the changes. They'll ask the same questions over and over, or they'll do. So, you know, if you know the person and know their normal persona, when you see different things, you realize that things are changing.
Something wrong.
Yeah.
Yeah, when your mother says, "Who are you?"
Thank goodness my mom never said that, but she knew me to the end. But there were other signs that she, you know, she asked the same questions over and over, or someone would come to visit and she would know when they were there, and a little bit later, if you say something about them, oh, I haven't seen them in a long time, you know. So
Yeah.
just little things like that, and you know things are changing.
With another log on fire.
Yeah, I was a little bit ashamed, well, a lot ashamed, because my mom would come over to spend on. I had a computer class in the evening for adults, right? A lot of adults had phobias about, you know, technology and computers and stuff. So she would come to the class, right? And you know, at a certain point, I think maybe the 3rd year of the class, she would ask the same question over and over again, and I would get very upset with her. And you know, people say, "Why are you so mean to your mom?" Right? Asking the same stupid question over and over. I just answered that. I mean, I got the negative attitude. I didn't learn till later what that was. That was like early. It was
Right.
early signs of dementia.
Yeah, right.
Yeah. So true.
Okay, let's go to the next one. Well, this is that weekend, huh?
That's right.
And every year, twice a year, we go through this issue about the impact of this daylight saving time on your health. And it's amazing the number of health issues that occurs. One of them is cluster headaches, migraine. It's interesting because this is fall back, in which you actually gain an hour. And the other thing about it is that the headaches are just one of the minor things. Then, of course, is the seasonal affective disorder that really is disturbing to many people. So many people have mental problems secondary to the SAD. But actually, the other problem is that not only sleep disturbances, but actually heart attacks increase during this period. And this is why many people think they should have one time period and not go back and forth with daylight saving time. Apparently, the mental health issues associated with this are also significant.
Dr. Callender, the amount of daylight changes regardless of if you change the time. So the seasonal affective disorder, I don't think has anything to do with the time, with fall back or spring forward. It's the amount of daylight causes seasonal affective disorder.
Whatever way you may call it, it is a type of depression that is alarming in terms of its impact upon people. What you say is true, but that still, seasonal affective disorders triggers a depression that lasts until, as you mentioned, the daylight increases. But in my view, this may be one of the most important issues that I see, the mental issue, but also the physical issues that are associated with the coronary artery disease, heart attacks, and those kinds of things that this article doesn't talk about too much, are some of the things that have caused people to strongly advise that we should do away with it. But what are your thoughts on it? Those of you who any of you have SAD, seasonal affective disorder?
My spouse does, and it's bad. She has to use a light box. But all I'm saying is kind of like what you just said. Just changing the time doesn't affect that SAD. It's the amount of light. So I mean, there's plenty of other issues. The issues with the headaches and the migraines and all that stuff definitely is affected by changing the cycle. Because I mean, your body has like a 30-day cycle. What do we call it? Circadian rhythms. And when you change that on the clock, that can mess up stuff. That I believe that.
Yeah, go ahead.
On a lighter note, I hate it simply because I have to go around the house and change all the clocks. It needs to stay the same.
Well, and while they talk about it twice a year, they never really haven't done anything about it, one way or the other. I think they talk more about the cardiac issues because they have done studies that identify that you have more heart attacks when you spring forward, and why that is the case, I'm not sure, but there is a correlation. So
you lose that hour of sleep.
Yeah.
There is a initiative out there somewhere where they're trying to make the United States all on the same time zone. It hasn't gotten off the ground too much yet.
Well, once a year they have that dialogue.
Yeah.
But and because it was in the Congress of the United States, and it got close to it at one point, but we'll see what happens.
My question is, will that change anything about depression and all that?
I guess we'll have to wait and see. I don't know, because I don't know. Mental health is one of the things that has become a crisis in epidemic proportions, and so it'll be interesting to see its impact upon depression. This is an article that kind of surprising to me, that there are certain medications that are linked to sudden cardiac arrest in patients with type 2 diabetes, and some antibiotics and antipsychotics have been associated with an increase in people dying suddenly. 50% of all cardiac deaths related to sudden death, and somebody doesn't wake up in the morning. And why this association with type 2 diabetes is a question, because it is recognized as a fact that people with type 2 diabetes are associated with not waking up in the morning, a higher incidence of that type 2 diabetes. Understanding exactly why is not clear. And they talk about the EKG changes with prolonged QT intervals, which is what you notice on the EKG, PRST, QT. And they found that those people who are on this certain antibiotics and certain macrolides and certain antipsychotics were those. So these are not studies that really have been done in the United States. But outside of the United States, the question is, do we have studies in the United States similarly to identify whether or not these macrolides and these antipsychotics should not be given to patients who are type 2 diabetics? And they list some of the medications that, and you see the fluoroquinolones, the macrolides, and the haloperidol is another antipsychotic that they mentioned. And the data are suggestive in those areas. But it's not significant enough to affect in this country the way in which antibiotics and antipsychotics are used in people who have type 2 diabetes. Type 2 diabetes is the commonest diabetes that we have in people of color. And this is a cause of alarm and a cause of need of studies to identify if this is valid for us. So this is very suggestive, but I'd like to see more studies done in the United States on our people to see if this warrants the avoidance of use of these antibiotics and antipsychotic medications. People who have type 2 diabetes.
Dr. Callender, I see this, but do they know why?
Yeah, they're pointing to the fact that the QT interval is something you see on the EKG, where if it's too wide, then the heart will stop beating. So it's interaction with the rhythm, and as we know that many of the sudden deaths that occur because of cardiac arrhythmias, where the heart just stops beating. And so the thinking is that it's the QTC prolongation that is the problem, and this causes the arrhythmia that causes sudden death. That's the thinking behind it.
it's just hard for me to understand or even conceive of antibiotics being in the same category as antipsychotics.
Well, it's just that both of these medications prolong the QT interval. And since prolong the QT interval is something that is associated with heart stopping beating, that's the association. So the drugs don't have to be similar, except in the way that they affect the heartbeat.
Okay, thank you.
Now, the only problem with this is that it hasn't done among our population, and that's what I'd love to see more of.
John, can you scroll up so I can see what those good medicines are?
Yeah, macrolide, that doesn't help you, but fluoroquinolones are a special kind of antibiotics, and haloperidol is an antipsychotic that is commonly used now. But they all produce that same QTC prolongation, which is seen on the EKG when you look at the way the heart beats. You see that it beats in an orderly fashion. And if you prolong the interval between the Q and the T, then in some instances this causes the heart to stop beating.
So I thought that there was allopurinol, which is sometimes used to fight gout.
Right. Yeah, but this didn't. Allopurinol was not one of the ones that they mentioned.
Okay, that's what I wanted to know.
That's what I think.
Yeah.
Haloperidol is an
I'm like, what's going on?
antipsychotic medication.
Yeah, you got anything?
What was the question?
No, my husband is asking me about some of his he's a diabetic, so it piqued his interest. Any common name drugs, antibiotics that would fall in this category?
Well, fluoroquinolones are a category of antibiotics, but that's not that common. Most of the antibiotics that we use are not fluoroquinolones, but there are some.
Okay, but
The common antibiotics are not fluoroquinolones. But when you talk about fluoroquinolones, trying to think of the name of some of them. I'll look it up while we're doing that.
okay.
Yeah. Now this is a challenge for vaccination. It seems like most Americans are not getting the COVID vaccine, and it's a cause for alarm. The RSV vaccine is question is, are they having quantities sufficient for that? And how many of you have already gotten your COVID shot?
I have.
I got all three.
This is Sylvia. I got all three, including the flu, COVID, and the RSV.
Good. That's good to hear.
And we've gotten flu and COVID. I haven't gotten RSV yet.
Okay. Well, I've gotten my flu shot. I haven't gotten my RSV or my COVID. Anybody have difficulty getting it or finding it?
Yeah, RSV was hard to find, but as soon as it came available at Kaiser, they started signing people up.
I had my flu shot, and when I went to get my COVID, previously my COVID shots had been Moderna, but I couldn't find Moderna now. And I know at one time you said it doesn't matter,
Doesn't.
or does it?
No, it does not matter. Whether you get Moderna or Pfizer, doesn't matter.
Mhm.
But the fluoroquinolones that you asked about, ciprofloxacin, levaquin, are the common antibiotics that are for fluoroquinolones. So anyway, that isn't as common as some of the other antibiotics. But anyway, that's the name of some. Ciprofloxacin would be the commonest of those.
Okay, thank you.
Look at you, Dr. Callender, technology fluent. You're looking on your phone and asking AI to name some things for you.
Yeah, that's progress, isn't it? Yeah, yeah. Okay, well, I guess it's November now. Today is November the 2nd. So this is the month that we need to get all three of those vaccines if we can. Because the flu season starts this month and by the end of this month.
Yeah, I wanted to make a comment. I think we mentioned last week, not to become complacent about your prevention methods, hand washing, social distancing indoors, especially, and mask wearing. I had two friends. In fact, one of them was at Kevin's funeral and called Major the next day, and she was standing like right behind us.
Really?
She had COVID. But it's, to me, it's like common sense. If you got a sore throat, you start coughing, you don't go back out, inside. It's like, it's so selfish for people to do that, not be considerate. I mean, if somebody's not vaccinated and they get COVID, they can die. So it's like you're like a loaded weapon.
It was interesting before that celebration. There are a number of people who didn't come to the celebration because they had COVID. It's important to remember if you're going through airports, you need to still wear those masks, as John has talked about, because this is the flu season, and on the airplanes you're pretty good because they've got a good ventilation system. But in the airport and in closed places, it's still important to wear the mask.
I'll be traveling this weekend, going to Mexico, and in the airport, I will have my mask on. On the plane, I'll keep the mask on unless I'm eating.
Probably the wisest thing to do. Okay. That is an article that talks about risk of strokes because some of the vaccines had been associated with clots. And so there have been some studies that demonstrated the correlation of COVID shots with stroke, although it's 3 for every 100,000 shots given. That's
Particularly.
which sounds small unless you're one of the 3.
Mhm.
Yeah. So now that reminds me that for your flu shots, you got to remember that if you're over 65, you get the double dose
Mhm.
because your immune system is not as strong as the others. So remember that you ask for the double dose, the high potency one. So you don't just take the flu shot, you take the high potency flu shot, and you ask specifically for it. And they have it, but you have to ask for it. Well, usually if you're over 65, but if you're in early 60s, they won't give it to you unless you ask for it. You all remember to ask for the high potency shot?
Yes.
Good. Okay. All right.
I
My
think I
primary-
forgot to ask that, Dr. Count. This is Sylvia. I just, when I went to Costco, I checked the box COVID and RSV and the flu, but he didn't mention, the pharmacist didn't mention anything about the high potency. I have to look at my report and see if that was done, but I forgot to mention that.
So did I.
My primary care physician administered my flu shot. So, I'm sure he gave me what was required because he knows my age very well.
Well, that's not good enough.
Yeah.
That's good enough. You should remind them.
Right. Mine was done by my primary care, and I asked and double asked, and it was.
How can you tell if you already got it? I mean,
You can't.
I'll be 74 on Monday, I think. Is it Monday?
Birthday.
Yeah, Monday. And so they should know I'm old enough to get it. But if I were looking at my record, would it say on the vaccination record?
Well, I'm not sure. It's high potency HP is what it would say. Whether that's on your record or not, I'm not sure. I just know that when I went to get mine, I checked off the high potency one, so that to make sure that they gave it to me. But then I'm much older than you, so it's more important. But I just try to get everybody to remind them just in case they forget and just give you the regular dose.
The important topic here is if you get the flu shot and the COVID shot at the same time, that's the high risk factor.
Yeah, and that's a good point. And most people don't get it at the same time. And recently Pfizer's looked at combining the two in one shot, but that has not yet been approved by FDA.
We got our shots with a day in between. One day we got flu and then skipped a day, and then the next day we got COVID.
Yeah. Right now, that's the way to do it.
I was glad I didn't have any side effects at all. Zero.
Zero here. Zero.
Wonderful. Good. Okay, next one. This is an article that talks about a new variant that is more common now and is effectively protected against by the updated vaccine. But the concern is that not everybody has been vaccinated. And 3.5% of the population has been vaccinated, which is scary.
So
Because it makes you think that people are complacent and that we're going to have a rough flu season.
yeah, what that also means is that those people that get it are going to allow that virus to continue to
Flourish.
mutate,
Right.
for more variants. That's the problem I see.
Yeah. Okay, well, I don't know what else to say except that it's discouraging that people have not received a shot yet. But let's hope that this month makes up for October. Most of the CVSs now have the COVID shots. I don't know about the. Did you have trouble getting the RSV? Did any of you have trouble getting the RSV?
When I went the first time, they did not have it, but then a week later, they said, well, when I went for the COVID shot, they said it would be in shortly, and like the next day, I could make an appointment.
Okay.
Dr. Callender, I believe about 2 weeks ago when I called Costco, they said you needed a prescription because they didn't have the approval just to give it. But when I went back to get my shots, they had lifted that waiver. So I was able to get the RSV just walking into Costco and the COVID and the flu.
Great.
So I saw 3 shots at one time. But as I said, I forgot to ask about the if you're over 65 for the COVID. So what do we do if we forgot?
Well, not for the COVID, for the flu.
Right.
Yeah, I'm sorry, for the flu. Yeah.
Yeah.
Yeah, I'm sorry.
Yeah.
I was just saying for the COVID. For the RSV, at one point they had indicated you need a prescription, and then when I went back to get my shot for the RSV, they no longer had that requirement.
Great. Okay. Next article. This is just an article that, we talk about the protection that the immune system gives us and how important it is. And this is an article that does a dissection of the immune system and talks about how many millions of lymphocytes and protective white cells we have in the body. And it's not expected that you would remember this, but just to appreciate the fact that we have T cells, B cells, and other cells that are so protective of us. And most often, the vaccines stimulate these cells to multiply and be even more protective. And there's just an article to kind of remind us of the importance of the immune system and the fact that we have millions of cells like this that are protecting us. And the greatest barrier to all of this is our skin, which is one of the largest organs in the body, and which protects us in large measure from foreign substances getting beneath the skin. And it's just amazing how we have a human body that has so many defenses against foreign invaders. The only thing it doesn't protect against is our own other human beings trying to destroy us. And so when you see these wars going on, it's just horrifying. Some people say that war is hell. Well, it's just horrible to think of so many people fighting and killing each other when so many people are fighting to live. But anyway, I thought it would be just a good idea to just remind us of how many ways in which the human body is prepared to protect us from foreign invaders. If only we as humans would be as protective of one another rather than destructive.
Dr. Callender, when Dr. Atto and I were in the immunology training over at the NIH, we learned a lot about the immune system. They told us that our immune system could recognize over 3 trillion different surface structures of antigens and could develop responses to over 3 trillion different invaders. That to me is amazing. 10 to the 12th power.
It is. And this article recapitulates that. Okay, let's go to the next one. Now, this is the fact that indoor air systems are crucial to the curbing spread of viruses. And that's why, in many ways, if you're indoors and they don't have a good air system, you're in trouble, whereas these systems are efficient and effective. That's why in an airplane, for the most part, you are protected because they have a good indoor inhalation system. And in hospitals, they have similarly. But when you go to restaurants, you're not sure what kind of system they have. And that's why if you're not sure, you probably need to wear a mask.
Dr. Callender, I had a question on the previous article, quick question. John, you and Dr. Atto went through that training, talking about the immune system. How much of that study was on the subatomic level, molecules?
Yeah, no, not subatomic, no, cellular. That was, yeah, on the cellular level.
Okay, because molecules have a lot bigger.
You got cut off, John. Okay, he's on the phone.
Yeah, okay. Well, I think this just reminds us that we need to continue to be masked. As Buchanan had pointed out, we can't be complacent because we're heading into the flu system. And ventilation is not always there, so we have to protect ourselves. And this article shows that with ventilation, how much the infection decreased by at least 80%. But we don't know exactly how much ventilatory support we have when we go to different locations.
If you look at that photo, that's exhaust from somebody's mouth, even though it's smoke, but that's the same way that viruses spread.
Kind of scary.
I was going to blow that up, but it was too scary.
Yeah.
Dr. Callender, on a side note, your advice was right on. I just called my doctor's office, and even though they know my age, they gave me the regular dose, and they do not even have the double dose. So I said, well, I'll come back. They said, no, we're out of flu shots. So what do I do now? Do I just go get it again? Is that what I should do?
Well, that's an interesting question because what I would think that might be the best idea is to get a high potency shot wherever you can get it.
Okay.
And you might find it at CVS.
Okay,
but you got specifically asked for high potency because it's a double dose.
Exactly. And it's not like you can get the regular dose twice.
No, I don't know that that doesn't. So I think you would need the high potency. And it's interesting that the people you rely on who should know better don't necessarily do better.
She said she thought I was 35.
Next one, please. No comment. No comment to that.
Okay.
Yeah. This is interesting. We talked something about this and the fact that we talked about people in coma can hear what you say often, even though you don't know it. And this is a study that evaluated consciousness during sleep, and they found out even though people were asleep, they could answer questions, which is remarkable. Depending on what kind of whether they had rapid eye motion sleep or not. And so they did tests on these people who were sleeping, and they were able to get responses. And it's interesting that when they were awake, they didn't remember interacting at all. So it's interesting. So actually, the reason I thought this was interesting is because sometimes when you're in a room with somebody who's supposed to be unconscious, you presume they can't hear you talk, but you should presume that they can hear you talk. And therefore, you need to monitor your conversations around people who are presumed to be unconscious and around those who are presumed to be sleeping as well, because sometimes they can hear you.
Dr. C, what is narcolepsy?
Narcolepsy is a condition in which people are speaking to you. They fall asleep while they're speaking to you, and then they may wake up afterwards and continue the sentence. So I have a friend who's narcoleptic, and they will, in midstream of conversation, fall asleep, and then wake up and continue their conversation. So it's not a common condition, but it's something that you see every now and then. And there's a treatment for it, but for the most part, these people, even though they sleep while they're talking to you, and they wake up and continue their conversation as though they hadn't fallen asleep.
Do they start back at the point where they left off?
Yes, they do. Yeah. I've only interacted with one person in my life who was narcoleptic. But my wife has interacted with a number of people who are narcoleptic. Any of you?
Dr. Callender, I know of a guy who claimed he had narcolepsy, but really he was high on heroin.
That's different.
They nod
Yeah, that's different.
Yeah, it's called nodding. You're right, John.
Right. Yeah, okay. Anyways, just to know that this condition exists. This is something I thought was important for us to know about. So many of us may use eye drops,
Don't snore.
a number of different conditions. And so FDA flagged 26 eye products because they felt that they were producing infection. So
Are these the store brand products, not?
well, for a full list, you can look at that. You click there and get a full list of the eye care products that the FDA identified.
Okay. Okay.
This is the list coming up.
Okay. Oh, okay.
Man, I asked you that that's for a reason.
You know what, Dr. Callender, could possibly some of that could be
Sure.
germs from the fingers getting too close to the eye.
Well, this is where the germs are in the eye drops, not in the fingers.
Got it.
It's amazing, 26 products. Wow. A lot of people have dry eyes.
I'm one.
Yeah. And so they have to use these eye drops to keep the eyes lubricated. It's an article that uh, uh, identified that older people who are sedentary, if they got exercise intervention, it slowed down the kidney function decline. And this then is recommended. And it talked about the average number of steps daily and how, as they increased the number of steps, there was a decline in the rate in which the kidney function was lost. It was just another way we call to talk about how important exercise is in all health, especially kidney health. It's amazing that you would think that exercise would enhance the glomerular function of the kidney, but it does. A lot of studies that are identifying that there are so-called senescent factors which increase the rate at which your organ functions decline. And if these substances are eliminated, the tissues respond by becoming vital again. And so the aging process is a process which can be altered if you find out what are these so-called senescent factors that causes the vital cells to go to sleep or even die. And this is a new phase of research, looking at these so-called senescent factors that put our put our cells to sleep. Have you heard that term before, senescent factor?
Yes.
That means that factors that cause our tissues to age and to not be cause the mitochondria and other things to cease to function. And the more you exercise, the more you activate those things. This is a article that has caused some concern because so many people are on PPIs, proton pump inhibitors for GERDs. And there's a study that suggests that you had an increased dementia risk if you took PPIs for a long period of time. That's what this article is about. Since GERDs is so common, it becomes important to recognize this, although whether this relates to people of color or not remains to be seen. But it was interesting. If you're over 90, it didn't matter. But if you're under 90, it seemed to matter. But remember, these are studies that were done in Copenhagen and other areas where they don't have many Black people. So whether or not it relates to us or not remains to be seen. And that's one of the things we have to look at when we get studies done is where are they from? Are they people who look like us or not? And that's why we have to have more studies that involve people of color, so we can know whether the studies relate to us or not.
Yeah, Dr. Callender, I have GERD pretty serious before I was taking the medication, and I was using Prilosec. It's over-the-counter medication that I read maybe a couple years ago, maybe when we first started. I first started coming to the group.
I remember.
That constant use of that. Now I don't know. Maybe Daryl would know whether Prilosec is a what is it, a PPI?
It is. It is.
What about because my doctors took me off of that and gave me a different one, famotidine. Is
What's
that
the name of it?
Famotidine.
Oh, okay. All right.
I don't know if that's a PPI. Daryl, do you know? Famotidine.
I'll look it up for you.
Okay. Oh, Doc.
Yeah.
Yeah, I got
Well,
a friend named AI. Most of the time, my friends right on point.
They're both over the counter.
famotidine, huh?
Yeah.
Let's see.
Go up on the article, John.
It doesn't say, let's see. It doesn't say whether it's a
That's good.
doesn't say whether it's a orange.
All it says this is an H2 antagonist. I don't know what that means.
Well, it's H2 antagonist is not. It's not a protein pump inhibitor.
That's hydrogen.
I think that might make it okay. I'll ask my doctor when I see him.
Yeah, it apparently is not a PPI. Although this is a interesting article, again, it's an association that may or may not be appropriate. But it at least in this Danish registry, it was associated with increased dementia risk. Now, whether that relates to people of color or not, we don't know. It's an interesting article that some men may love to see, that exercise is as good as Viagra. Whether that's true or not remains to be seen. But anyway, this article suggests it is good for ED. To say that it's as good as Viagra is a stretch, but it certainly promotes erectile function. Yeah. And then when it says it's similar, they don't go into the detail to tell us how similar it is, but we know that erectile dysfunction is markedly improved in people who take Viagra. The extent to the improvement with exercise is not detailed. So, but anyway, it certainly will improve erectile dysfunction. So, So exercise seems to help almost everything. This is another article, and I guess better stop here because it's 10:30. This is an article that said if you snooze for another 30 minutes, that improves your cognitive ability, which is an interesting thought that snoozing was as good as playing chess, which is quite a statement. But anyway, they did point out it's amazing. They do research on everything you can imagine. I would never have thought of doing that research on finding out whether if you snooze for another 30 minutes or jump up, that it would make a difference. And lo and behold, they did a study and found that snoozing had clear effects on the cognitive. But it only if you snooze for 30 minutes or longer. Yeah. And that, so they only know about 30 minutes now. If you shorter or longer, they weren't sure, but that's amazing. Do you hit the snooze button when you wake up, or do you use an alarm clock?
I usually don't, but I had a question about cortisol. What is that?
Cortisol is a substance that is produced by the adrenal gland on anytime you're stressed, and so it's a product that whenever you wake up or any stressful situation, waking up may be one of them, causes an increase in cortisol. So it's a hormone that the adrenal gland produces whenever you have any stimulation.
This article validates the fact that when my husband wants me to get up to cook breakfast and I lay there for another 30 or 40 minutes, I'm doing the best thing for my health.
Right. Yes,
Yes.
yes, it does. For your mental health, anyway.
My husband said, no, I'm not doing the best thing for my health.
Okay. Is this the last one or is there another one? Oh, well, this is something we really never talked about, but it's interesting because after Hamas attack, where they killed all the Jews, a lot of the Jewish people, Jewish Americans are arming up because a lot of people are talking about killing Jews because Hamas said you should kill Jews wherever you can find them. There's a situation that I've never seen before where a group attacks somebody and kills people, and they then are talking about killing Jews. So it's an interesting phenomenon that